too hard. If you push too hard, you actually occlude the vein and you won't feel it. Just rest your fingertips on it and you'll feel this pop, 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 pop. If you don't feel it, that means our blood pressure is so low our kidneys are not getting blood. And that is also a problem. But, so if you can't feel a pulse, we probably need to be helping out that part with CPR. Oh my God. So compressions, there's two different types of compressions. CPR has evolved since I first took it. So there's intrathoracic pressure versus the cardiac pump theory. And the best one depends on how big the animal is and what their body shape is. So positioning, if we have a less than 5-pound dog or cat, and we're going to want to do the cardiac pump where we're actually pushing right over the heart. And again, we're going to move that little elbow up so it's right on the side of the rib cage, and that's where you're going to put your hand and you're going to squeeze. When you do that pump, and I'll go into a little more detail about how to do it, but you're actually putting pressure on the heart to empty it and let it fill up again, and empty it and let it fill up again. You are beating that heart. For bulldogs and anybody that is deep-chested and over 15 pounds, wait, let me back up. The little guys too, if you don't have the hand strength to do one-handed compressions, or they're a little bit bigger than that but not big enough to do other types of CPR, you can put both hands around them so that, can I borrow the baby? Oh, it's okay, that's okay. Just for
Dr. Rosie's
purposes.
used to it. We bring her a lot of stinkies.
I love the stinkies.
Oh my goodness. I'm just gonna need a minute.
Hi, sweetie.
Okay. Yeah. So on a baby girl this little, I know. Are you looking at the presentation? So we would move her little elbow this way, and you can feel like her heart is right there. And you would put, are you looking? You would put your thumb over that, and you would do compressions this way. Other option, you are so cute, is to pick us up this way, and you have your hands around both sides, and you can do the compressions this way. I'm not going to push you on you. This was just my excuse to snuggle. Oh my goodness.
She's already so popular.
I can hold her so she doesn't have to go back.
Okay, don't trip.
Don't trip on Mojo.
All right, Mojo.
I know, you're adorable too.
Oh, pumpkin. Oh, fling it. So with bulldogs, and this is the newest information, this is a little bit different. We used to do all dogs on their sides for CPR. But with bulldogs, it's actually better for them to be on their back. And like I said, this is new information. You probably are going to have to prop them up with something on either side to be able to do this. But then you find their breastbone, and you want the caudal third of the breastbone, so you can feel their big breastbone, and you're just going to go to the last part of it, and that's where you're going to want to do your compressions. With normal dogs that have more narrow chests, you're going to want to do CPR on their side. And this is what they call the intrathoracic pressure. This is what this guy's doing here. And you go to the widest part of the chest. It's not the part that's over the heart. What you're doing is moving the pressure in the chest, and that is what's circulating the blood and keeping the heart filling. So that actually works better for the narrower chested dogs. But bulldogs, on their back. If you can't do it on their back because it's just you, or we can't keep them there, or you don't feel like you're getting good compressions, go ahead and put them on their side. Something's better than nothing. And if you feel like you're not getting good compressions, go ahead and put them on their side to do it. All right, so to do these compressions, we're going to want to depress the rib cage 100 to 120 times per minute. And what that seems like in real time is 1 and 2 and 1 and 2 and 1 and 2. Yeah, it's fast. And as you get more tired, you're gonna go from 120 to 100. Because it is hard to sustain this motion that long at that rhythm. And that's why it's recommended after 2 minutes, you need to swap with someone that's there so that you're consistently doing those compressions correctly. If you try to power through it, you're gonna get tired and we're not gonna get adequate compressions. When we're doing chest compressions, you wanna do them to a third or a half of the chest width. So you only want to go in that far. And it takes a substantial amount of force for a bulldog or any big dog, not as much for the little guys. You do want to allow the chest to fully recoil, and that's allowing that pressure back in, and that's going to suck the blood in from the abdomen. And then when you go to push it again, you have this new blood flow to push around the rest of the body. So. And then if you can, if there's two people trying to do CPR, if you can give the breaths at the same time as the compression, actually again increases that pressure in the chest and we're going to circulate more blood. So, and what that's going to look like is 2 breaths to every 30 compressions. Okay, so whoever's doing the rescue breathing is counting to 5 and giving a breath, and whoever's doing the compressions is doing the 1 and 2 and 1 and 2. And this is good to practice at home too. You get an idea like what to expect time-wise. If you have someone that can look at their watch when you first start doing it, it's really important to, if you start the compressions, keep them going for a full 2 minutes. It takes that long to get the heart full and to get the blood circulating. If we stop and keep stopping to check the pulse, we're not getting the blood anywhere.
Right.
So we have to do it the full 2 minutes before you stop and check anything. So this is a great algorithm that was put together by the Recover Initiative. I've modified it a little bit because this is just for basic life support. When you're in a hospital setting, this algorithm is like this long. And has everything that we should be injecting, how many fluids we should start, all of that good stuff. But for the purposes of what we're going to be doing, this describes 1 full cycle of our compressions is 2 minutes, and that's uninterrupted compressions with ventilation, 30 to 2. The chest compressions, again, a third to a half of the depth of the chest, and you allow the chest to recoil, and we want that 100 to 120 compressions per minute. Ventilation, 10 per minute. As soon as we get to the hospital, they're going to try to intubate that animal so that we have better control over the airway and we get more air in. But for now, you guys just got to do the best you can sealing the mouth. And again, if you can't do that, just do the compressions. We might be moving enough air. So again, do not stop for the whole 2 minutes. Assess for the pulse. And again, you can do that by putting your hand where the heart is. You can feel the pulses on the back legs. And then change people and keep going. When to stop? The guidelines say when you are exhausted and cannot continue, or when the animal has been transported to a veterinary facility and the professionals can take over, or if the pulse is suddenly palpable. Suddenly you got a pulse, we've got a heartbeat back, and it's strong and regular. If it's still pretty sketchy, do another 2 minutes. You're not going to decrease the risk of them bouncing back by doing additional CPR. In most cases where we get heart function back, we still have to rescue breathe for them. Their neurologic system has become really depressed, and it's not going to tell the body, okay, we got to breathe now. Oh, baby pumpkin. It's like the cutest puppy yawn ever. You go to that? Oh, good job, good job. So this is an extra trick that we have done in the ER for years, and in the ER, we've been doing the wrong point. And now that I'm taking acupuncture, this is the right point. So I thought I'd share all this with you. This point is called the governing vessel 26. It's right at the bottom part of the nostrils in the center. It's not where the lip meets the nose. Like, go up a little bit from there. This acupuncture point, if you have a little 25 gauge needle, or if you have needles lying around for fluids, or if you want needles in case you have to do acupuncture suddenly, let me know. You point you put the needle in this point and you twirl it. In Chinese medicine, you twirl it to the right to tonify the system. The instructors I've had say just put the needle in it and move it around. So this particular point stimulates brain activity and has been shown to increase heart and respiratory rates. Whenever we have animals that are having C-sections and we have puppies that are being born that are slightly anesthetized and aren't quite taking their full breaths yet, the first thing we're doing is putting a needle in that point after we suction all the glue out. Put a needle in that point, twirl it around, see if they'll breathe on their own, and if they don't, then we get to start rescue breathing. So those are all the tools in the toolbox that I have for doing CPR to start with until you guys can get to where you need to get. And just know that at some point you did all you can do. And then we have to turn it over to Lily. You guys have any questions?
If you're home alone, at what point do you want us to load them up and bring them? Once we get heart rate back?
I would say, if you have no one else there, I would say if you can get the heart rate back and be driving as safely, like we don't want to endanger your safety either. Don't get any car accident on the way there. But if you are able to rescue breathe and drive as carefully as you can, I would say that would be the time when I would consider moving them. But again, as safely as possible. If you can call someone nearby first that can run over and help you, that's going to be better. I don't want anyone to get hurt when we know that our chance of getting these guys back is really slim. Like, it would be a disaster if we lost you and your dog. So only if it's a safe thing to do. And some of these guys are just so big, we just can't. The other thing is if you have something where you have an elongated seat, again, the most important thing is going to be doing those compressions, and the ventilation will follow. So if you can drive and do one of these, I guess that would be my second option. Hopefully we don't get to that point. And again, always with caution, because we're more worried about you guys. I love these guys, but again, be careful. Other questions?
Really quick, just to emphasize, so you said when you begin to do CPR that you pull the tongue as far out as you can and at that point create the seal. But if the tongue is all the way pulled out because it's so big and fat and bulky in their mouth, then it seems like if their tongue is hanging out, how do you get around their tongue to do the mouth-to-mouth?
Well, their tongue doesn't usually hang out willingly. So you're pulling it out while you wrap it around, and the hope is you can produce enough pressure by breathing through their nose that just moving that soft tissue forward and extend it a little bit, we can get back to the air passage that goes.
I was trying to visualize that.
So, for example, with Koa, when I was doing CPR on the side, so I had his tongue pulled out, and he had real stenotic nares, but I was still able to force air in. I could see chest, his chest rising, even past the nares. Yeah, unfortunately, he passed away, but I could still see the air. Yeah,
okay.
Yeah.
We're trying to get it to go down this back alley from the nose into the trachea while you've moved all this out of the way to be able to do that.
Okay, yeah.
But truly, you should do compressions more than breathing.
So bulldogs, like I said, most commonly it's an airway obstruction. So if you can intervene before we get to the point that our heart shuts down, if we're blue, if we're not moving oxygen, this is where you can start.
This is the best morning ever.
Oh, puppy.
She's ridiculous. She is ridiculous.
Any other questions?
Yeah.
So I did have someone who asked me specifically about tracheotomies in the field. Do you guys want to know about that, or is that a bit gruesome?
I want to know about it.
Well, I mean, in my theory, if they're already,
Right, I mean, they're
if
already dead.
if you've attempted everything and there's, I mean, that's not strong.
Yeah, it is like last resort, and I would rather, most CPR instructors don't talk about this, but I would rather you guys hear how to do it properly than again, try to Google it. So if these guys are so swollen, we can't get any air in, and we have to do a tracheotomy. The first thing that you're gonna do is feel where that Adam's apple is. Then that's that hyoid cartilage. That's a big bony thing that we talked about, okay? And you're gonna go below it. So it's usually gonna be, and this is something you have to watch with these guys, in their neck folds. So if you have something that can hold those neck folds up, if you've got a butterfly clip or something and you can hold them back, that's gonna help you in this case. Don't worry about sterility. Like if we get to the point that they're breathing, we can fix all that later at the ER. Like we can fix an infection. We can put in a temporary tracheostomy actual tube if we need to, but we have to get to the point that we get to the ER. So if we are blue, unresponsive, the heart's still beating, and you know it's an airway issue, you've checked the airway, you've made sure everything's cleared out, but you see that it's super swollen and there's no way we can get air in there, and you've tried, and it's just the chest is not filling. Like that is when you would do an emergency tracheostomy. So you can feel the cartilage in the trachea. You'll feel hard, soft, hard, soft, hard, soft. And you're not going to, there's no blood over the trachea right here, except little superficial bleeders in the skin. All the major vessels are over here. You're not going to hit those. So don't panic. And you're just going to stretch the skin, find a point below that voice box, and with a really sharp blade, you're just going to make a hole and you're going to keep going until you get through the trachea. You can get halfway through the trachea and you're not going to damage it long term. Like that's okay. You're just trying to make a slit in it, and then honestly you got to stick your finger in and twist so that you're, because it's going this way and you want to open it this way. And if you hear them go, then we've done it. You know, we've been able to move air in there. I'm sure everyone's heard the stories online about people doing this in restaurants and using a pen or something to hold a straw. Yeah. Straw is not going to hold that open. So it might have to be literally someone sitting there with their finger in it until you can get to the ER and we can place an actual tube in there. And typically, if that happens, we place a tube, we sew it in place, we give the tissues a chance to decrease all the swelling up above. And sometimes that's steroids, sometimes it's soft tissue surgery, but you know, I've had to do a number of emergency tracheotomies and tracheostomies at the ER. I did a lot of ER work, and sometimes it can be life-saving. We've had to do a couple here, and get the tube in, and then we end up transferring them once they're stable. But it can be life-saving for these guys if they have that much swelling and you just cannot move the air. So keep that in mind, back pocket. If someone asks you about it, I didn't tell you.
It's important we know.
I feel it is. Like, I would want that tool in my toolbox if I were a pet owner and didn't know what to do. Actually, you can tell them I told you because they'd be like, oh yeah, Rosie. She would tell you. But yeah, that's going to be emergency medic training. That's how you're going to do a tracheostomy. And honestly, if you're at that point, you have nothing to lose.
Mm-hmm.
You guys are having quite the little romance up here.
Bella just wants that baby.
Yeah, she does. She wants the baby.
Oh,
She's a mama.
oh my goodness.
Gosh, so funny.
Any
She's
other
like, you're not
questions
doing
at all?
it right.
It's not, yeah, she's like, it's dirty. You
Yeah,
fix
she's
it.
like, you're
Yeah.
not doing it.
I'll clean the baby for you.
But like I said, I have handouts up here for you guys. If you want to like take a copy of each and pass them
fantastic.
around. And then there is a sheet here, so if you want to do, if you have additional questions, you want to communicate with me privately, just go ahead and shoot me an email, and I'm happy to answer any questions you guys have. Thanks so much for coming.
Awesome. Thank you. Thank you.
So helpful.
I'm glad that